I was one of those kids that probably from age 10 wanted to be a neurosurgeon. So I always wanted to be a neurosurgeon and was sort of a surgical geek, I guess is the term. And I grew up in Canada. As I went to medical school, I actually went to medical school knowing that's what I wanted to do, residency in neurosurgery, then subspecialization in neurosurgery. And then I basically ended up Southern California for my first job, right out of subspecialty training. I came to help out the community because they had an emergent shortage of neurosurgeons. And in the few days I was here, the then CEO was impressed with what I was doing, my way of talking to patients and nurses and dealing with acute emergencies. And they asked me if I could rebuild the neurosurgery program. So here we are, more than a decade later, having rebuilt it, having started residency programs, and become a comprehensive stroke center, have a spine center of excellence certification. So huge amounts of things have been done. The idea was to have a comprehensive team which was neuroscience, not neurosurgery, even though I am a neurosurgeon. And I wanted to make sure that we had all aspects of neurospecialties. For that, we needed the kind of people that were committed to building something, especially young people that wanted to take ownership of specific programs, and they were interested in teaching. So those are the two elements of what I was looking for in my colleagues. So it's just completely comprehensive neuroscience. At the desert, what has happened is we are now completely state-of-the-art for neuroscience. And this is a wonderful achievement for the community, because if you have a brain tumor or an aneurysm or a spine condition, this is really the place to be. I love neurosurgery for many reasons. Of course, there's the superficial reasons, like it's technically delicate. There's a lot at stake. We have the highest amount of technology in the operating room of any specialty. So all of these things are the superficial reasons, but the real meaningful reason is neurosurgery is the one specialty in which we really influence and change people's lives and essentially their soul. The diseases we deal with, such as strokes and brain tumors, can affect the essence of the individual, their perspective of themselves, their family, their place in the universe. And the things we do to them in an attempt to rescue them from those diseases can also affect their perspective of everything. So it's a great honor to be able to help people who are at risk of losing their essence. It really affects the outlook of the individual in a way that no other surgical specialty does.